you for joining us on today's webinar. I have a couple of housekeeping items to cover before we get started. The first is that this webinar is being recorded, and a link to the recording as well as a PDF of the PowerPoint presentation will be provided to everyone who has registered for today's webinar tomorrow via email. The webinar and the presentation will also be posted on the LiveWell Colorado website, and that information is included in a slide at the end of the presentation. The second item is that you are able to submit your questions throughout the webinar. To ask a question, simply type it into the questions box on your on-screen control panel, and we will address those towards the end of the webinar. So with that, I would like to turn it over to our first panelist, Wendy Peters-Muschetti.
Thanks, Alex. Good afternoon, everybody, and welcome to our third and final webinar in our spring webinar series of Fostering Community-Led, Action-Oriented Coalitions to Change Community Policies and Conditions for Health, Research Tools, and Case Studies from the Field. And today we will focus on that latter part of actually hearing some case studies from the field. So next slide. This is just me. We will also provide contact information again at the end. Next slide. Before I pass it over to our speaker, just wanted to let you know I just want to share a few words about the Colorado Food Policy Network. That is a network that has convened this webinar series. And then I will pass it over to our speaker, Molly Hansen, to do her presentation on building diversity to change policy and conditions in community and organizations. After that, we will have a chance to hear from you for some question and answer. Just by way of introduction, Molly currently serves as a health policy analyst for Jefferson County Public Health, where she has worked for several years. Working in conjunction with the Jefferson County Community Health Improvement Plan, she is implementing multiple different healthy eating and active living grants and projects throughout Jefferson County. Prior to this, she was the LiveWell Wheat Ridge coordinator and has several years of experience working on tobacco-free policy with a variety of public health entities. And she also sits on a wide variety of Metro Denver boards and advisory groups, and is a wealth of information of the world of healthy eating, active living, which you are about to learn. So next slide, please. Before I pass it over to Molly, I just wanted to give my standard little overview about the Colorado Food Policy Network. This is a network that has been in creation for a couple of years now. It is a network of networks. It is a network of local food policy councils, which we typically call food system coalitions, and the State Food Systems Advisory Council. We have a draft starter charter and governance structure in place, and are currently working on a variety of outreach and education and capacity building projects, including things like this webinar series, to grow the skills of local food policy councils to impact change, and to also sort of build a more collective voice around healthy food access policy together at a state level. As you can see here on this slide, our shared purpose is to promote healthy, community-based, economically viable food systems in Colorado that ensure all residents have access to affordable, nutritious food. To do that, as I said, we focus on building the capacity of local groups, working together to advance state-level policies and investments, and then creating conditions for deeper collaboration and impact. If you have more questions about the network or you're not currently involved, again, we will provide some contact information at the end, and I encourage you to get in touch with me. And with that, I will pass it on to Molly.
Well, thank you, Wendy, and LiveWell Colorado, and all the partners on the call for having me. I'd also like to thank my colleagues at Jeffco Public Health, the Colorado Department of Public Health and Environment, who provides funding for our healthy eating, active living, and built environment work, and my esteemed colleagues that presented before me, Dr. Jill Litt and Dr. Danielle Varda. Their work has really informed my practice for many years. I'd also like to thank many of my LiveWell community partners and public health partners who may be joining the call today. I feel we really build on each other's successes and lessons learned, and for that I am very grateful. I believe opportunities like this to discuss important issues like coalition building, shared leadership, and partnering more deeply with the community to make sustainable change is really important. So thank you to the Food Policy Network for putting on this great webinar series. I know I've learned a lot. So I'm going to take about 18 minutes to talk about some of the core themes that I've identified over the years when it comes to supporting community-led coalitions that work to make change in the community, or supporting organizational change in places like work sites or agencies. As Wendy said, I worked for about 8 or 9 years in smoke-free community movement here in Colorado. Then I moved over into healthy eating, active living, and I feel that through that work I've identified some cross-cutting strategies or approaches that have been helpful. So I look forward to sharing a few of them with you today. Next slide. So when Wendy and I talked about this, this seminar today, or this webinar, we talked about a couple different things, and I thought maybe I'd organize my discussion points around a couple learning objectives. So first I'm going to talk about this idea of choosing and implementing an organizing model to support coalition policy, system change, or built environment priorities. I think it can be very important for communities and networks to choose an organizing model. So I'll talk about some things that you might want to look at when choosing a model. And then I'll spend a little bit of time talking about building diversity and shared leadership models into how coalitions form and function. So, before we get started, I just want to say a few words that I'm very appreciative that people organize for different reasons. To increase access to healthy food, to eliminate hunger or homelessness, to change land uses, to increase affordable housing, to increase minimum wages. These coalesce groups come obviously in all different sizes and shapes and scales and forms. Many of us are very informed with networks and coalitions, but I'm going to sort of use that word interchangeably. Some networks are formal, some are informal, some consider themselves coalitions, and some of them consider themselves networks. Some come together just to share information, and some come together to change policy, environments, or systems. This is all good. I actually really think diversity in networks and coalitions are really helpful. Having said that, I do think that we often, these groups are similar in that they want to make change in the community. So I do think that there's ways to think about how to work together, and it's never too late to think about how we want to organize to increase our impact in the community. In this environment with resource constraints, we all need to be more efficient. We need to figure out how to have greater impact with less resources. We are facing unprecedented health disparities, inequalities, and divisions in our community. We need new and better ways to spread leadership and to partner deeper with our neighborhoods, communities, agencies, and governments. As Dr. Jill Litt said in the first webinar, coalitions are a fundamental strategy when looking across the spectrum of prevention to create conditions that foster access to healthier options. So next slide. So now I'm going to start a little bit talking about this idea that I think it can be powerful for networks and coalitions to spend some time choosing an organizing model. And I often say that it's never too late. Sometimes coalitions have been in existence for years, and they decide that they want to figure out how to be a little bit more impactful. So I often say that it's never too late to think about how you want to organize. So I'm going to spend a little time encouraging you to think about some of the things that you might want to look for when choosing an organizing model. So the first thing is I think the models that have a logical progression of phases that build on one another can be really powerful or very helpful. I think models that encourage coalitions to assess existing health and demographic data to identify the scale of the problem can be really helpful. So that's, looking at existing data. I think another important piece, obviously, to this is data collection. So, coalitions and networks will often have to do quite a bit of data collection. One of the things, though, that I think we often overlook when we do data collection is this idea of measuring readiness for community change. So I know when we were doing our smoke-free communities work, we spent quite a bit of time implementing the CSU tri-ethnic community readiness model, and I've included the link there. I think it can be a very powerful model for communities to use when having a very specific change that they want to work on in the community, to first assess the readiness and then to really tailor their campaign accordingly. I think another powerful step in a model can be if the model encourages the coalition to define the problem and identify the desired policy, system, or environmental change very carefully. So before we change slides, we can go back one, I just wanted to mention very quickly, in the right-hand corner of the slide is a picture of the Jefferson County Community Health Assessment from 2013. In Colorado, every county is now required to look at their health and demographic data through a community health assessment process and then identify community-based strategies to address some of their root causes of poor health. So I would encourage many of you to reach out to your local health department and ask for local health and demographic data. Many communities have compiled it into a recent community health assessment. Many of them have a report that you can access. If you have any questions about contacting your local health department about how to address or how to identify health and demographic data, please feel free to contact me. So another key piece to the model is describing how to build allies and champions. I think what's really important is that this is definitely a distinct step, but that coalitions and networks are doing this obviously throughout the entire process. Next, I believe the most important and most overlooked step is building readiness through education. Many of my friends and colleagues hear me say over and over again, educate, educate, and educate some more. Movements that spend time building the awareness of audiences first often get further later on in their campaign or policy work because they have built awareness. I believe organizing models that really draw out the various steps of educating and then message framing are the strongest. Next, often a next stage is building the political will that is often different from education. And I'll give an example in just a moment of what I mean by that. Examples of building political will were illustrated by Dr. Litt's presentation. Things like using media, earned media, social media, events, developing white papers or position papers, providing public testimony. These are all very powerful steps to build political will that will often move your agenda along. So what is an example of this, the difference between the education phase and then the building the policy phase? So I'd like to talk a little bit about our smoke-free communities work. So as I mentioned, I work here in Colorado to help smoke-free communities efforts. And we spent quite a bit of time really sort of differentiating between the stages of education and then implementing sort of a policy campaign. So what we did was we often spent months or years drawing out the health or illustrating and educating on the health impacts of secondhand smoke exposure for vulnerable populations before we ever talked about policy change. And when we found out that maybe that our policy campaign wasn't moving as far along as we wanted, we would go back and do some more education. So again, I just can't reinforce enough about the power of education, education, education. Next slide. Finally, strong organizing models often think about how to support organizations, governments, and communities through implementation. So I think a lot of times we think about our campaign or movement, and we don't think about this issue of implementation and enforcement. Often our partners, agencies, our networks that we're working with, our allied organizations, if they are implementing the policy change, we want to stay with them and support the implementation and the enforcement process. And then obviously, this issue of ongoing evaluation that both presenters before me talked about. I think models that really talk about evaluation and differentiate between the different types of evaluation is really important. So for example, measuring the impact of change on the community, and then measuring the impact on the coalition members and the coalition itself for actually participating in the community work. And in the second webinar, Dr. Danielle Varda did a great job talking about her tool, the partner tool. It's a very powerful tool to help coalitions measure their progress and their work to work together and to make change in the community. Our Healthy Eating, Active Living, the LiveWell Wheat Ridge Coalition participated in the partner tool, and we used the findings to help us develop our coalition and move on to next steps. So it was very helpful. So now I'd like to talk a little bit about some resources, technical assistance. These are some really great resources that I've used over the years. These, this is not an exhaustive list. These are some of my favorites. These websites and resources tend to talk about the how to do the work, not always the what. So these are just some great resources, and obviously feel free to contact me if you have any more questions about some of these resources. So a couple examples. So the first is with our Jefferson County Healthy Eating Active Living Initiative, we have a HEAL policy team. And in the very beginning of our initiative, we decided that we wanted to do some assessment on the readiness of our elected officials and our opinion leaders to implement a variety of healthy eating, active living policies. So we hired Spark Policy to assess readiness. And so Spark did a national scan and developed a wonderful tool that they implemented and put in the field. It basically measured the readiness of our elected officials and opinion leaders on a host of healthy eating and active living policies, everything from procurement, food policies, to multimodal transportation policy and land use issues. So we put a lot of work into this tool. The findings, the final report, and then 2 brief summary fact sheets with findings can be located on the link. I think the most important thing is you need to think about how you'll use this information to move your campaign forward. So I can think of one particular policy issue that we're considering addressing in the next couple of years, and we are relying heavily on some of the data that we found in terms of readiness around this particular policy issue to help us frame this policy issue moving forward. Another great example, next slide, is this wonderful work of the LiveWell Wheat Ridge Coalition. So the coalition had come alongside the city around 2010 and 2011 and several other organizations to fund and support the adoption of a downtown plan that had a very heavy component on making the downtown a healthier place through land use, transportation, and economic development. But first, the coalition wanted to promote this idea of a healthy downtown early on in the efforts to connect this idea of health to place. So the coalition used a downtown festival on 38th Avenue to just really do that education. That's when I mentioned education. This is a great example of really not talking about a policy change, but just increasing awareness. So what they did was they educated on the link between health and place. They collected data on priorities by doing a survey, and we asked people to do a mapping exercise. You can see that on the right. And then we asked members to sign up for more information and to join the coalition. So another great example of just educating, educating, educating. So now we're going to switch gears a little bit. I'm going to talk for a few minutes about how a coalition can plan and foster a shared leadership model. I will say that it's never too late. I believe it's never too late to look at this. I know many movements that have been in existence for years that have decided to pause to look at their leadership model to make it better reflect the values in the community. I don't think we should be afraid to do this. I think this makes our coalitions better. So some things to think about, really at any point in your process. The first thing is consider developing guidelines or values of how you want to work together. You might also want to carefully define your shared leadership and governance model. And in that process, you might want to spend some time defining how you want to make decisions and manage conflict. I think we often do not spend enough time with this. And then a lot of these items you can put in your organizing documents, and there's lots of great examples. We've used some charter templates from, I think, Nonprofit Impact, but there are some great organizing documents out there that are very helpful. I think that firmly grounding all coalition work in equity is very important. Obviously, this is a values decision and a process for a coalition or a network, but I think it can be really powerful. Recently, we hosted Mark Winnie in Jefferson County in early April as Jefferson County moves forward with developing a countywide food policy council. He did a really good job about drawing out this issue that firmly grounding all the coalition work from the very beginning in equity can help really drive and steer the coalition in a direction that's making very specific priorities when choosing what policies and strategies that they want to focus on. Next, I think it's important to work to ensure your coalition and coalition leadership really represents the demographics of the community. Again, I think this is always a work in progress, and I think the community really needs to define how to do that. But I think constantly working towards this can be very, very helpful. I think ensuring a healthy coalition mix is important. This is really a science and an art. There's so many theories out there about how to create a powerful mix of partners in your coalition. I think it also really depends on what you want to do and how you're organizing and what level of your community that you're organizing. But some things to think about is including a mix of sectors and disciplines, a mix of community residents, opinion leaders, and neighborhoods. I think involving local government staff is helpful because they often know the process, and if you're working on public policy, they can help you with that. They can help you navigate the system very efficiently. I think having a mix of elected and appointed officials is really helpful. I think having youth and then foundations, healthcare, business, economic development, and faith communities are very, very helpful. So next slide. Oh, thank you. I've noticed over the years that we often think our membership, our coalition membership is static or set. And I really want to challenge this assumption. I think movements are organic. I think it's a continual process to examine your coalition and your leadership. I think attrition is natural, especially when we're working on these long-range issues. Looking at land use, transportation, and food policy takes many years. So we often have to have a flexible coalition and leadership structure so that people can move in and out and change roles. Also, our coalition makeup may change as our priorities change. I think throughout the process, using a variety of mapping exercise to identify who else needs to be at the table is important. And I always think it's important to make sure you orient your new coalition members. So in conclusion, I think that it's, again, very important to appreciate that these coalitions and networks are organic. They will evolve, and this is a good thing. I think the importance of planning really at any phase of the coalition is really helpful. I think it will increase the network's coalitions and impact coalitions or the network or coalitions impact in the long run. I think the power of shared leadership approaches and spelling that out in your organizing documents is very, very important, especially as your leadership and coalition members change in and out. I think choosing an organizing model carefully is really very, very helpful. And I think building the capacity of the coalition around equity and rooting all work in equity is very, very important. So thank you so much. Wendy, back to you.
Wendy, you may be on mute right now.
It took me a while to unmute. Hello, I'm here, everyone. Hey, thank you so much, Molly. Thank you. I love this, and what I love about it too, as someone who's also, trying to do some of this work, is that there's some really important key steps here, and even some chronology that you gave us, Molly, but also that message that it's never too late, which actually makes me feel a lot better as well. So there's this great, series of steps, but it's never too late to go back to step 2 or 3 or 1 or whatever and kind of reassess where you are. So incredibly helpful. I do have some questions, but I want to make sure that everyone on the line has a chance to answer their questions. So if you have a question, please type it in now for Molly. And I cannot see those questions. So Alex, I'm going to have to let you moderate any questions that come in.
Sorry for interrupting you. We do not have any questions yet. Feel free to type those in as we go, and I'll turn it back over to our panelists.
Thanks. So I have a question for Molly, and will you just interrupt me, please, if other questions come in? But one thing I have always wondered about a little bit is the evaluation piece that you talked about, and that importance, Molly, of measuring impact and change, and not just within the community, but within the coalition itself. So I'm wondering, are there things that you have seen work well, or that you suggest that networks start documenting or collecting very early on? I think a lot of times people think about evaluation 2 years into it, right? Like, oh, let's evaluate how the program is doing now, when there's things and activities they maybe could have started asking or documenting from the very beginning. So do you have any thoughts on that, sort of early on documenting evaluation techniques that you've seen work well or you would suggest?
Sure. I sort of think about evaluation in two different buckets. I think the first is measuring the impact of the coalition and the individuals, and then measuring impact or change in the community. So let me start first with the first bucket. Does that sound okay, Wendy?
Yeah.
So I think one of the first things is, doing a baseline assessment on coalition members' confidence to execute the steps or phases of the policy. I think the overall, coalitions rating their satisfaction of their experience working together can be really helpful. I think also the partner tool can be very, very helpful. From my experience, we did the partner tool several years into the LiveWell Wheat-Ridge Coalition, and it measured several dimensions around trust and impact and efficacy and working together towards sustainability and policy change. That might be a little ambitious early on. So I'm wondering if that, looking at having individual coalition members doing some baseline assessment around confidence, really drawing out the various levels of or phases of a coalition and coalition members of their confidence to implement those steps, and then maybe going back a year later and seeing if those coalition members feel more confident in implementing some of those steps. And then I think in terms of the bucket around measuring, collecting baseline data on sort of the impact of the community, I definitely think it depends on the area that you're working in. So for example, with LiveWell Wheat-Ridge, they had identified a number of policy strategies to make the downtown more biped friendly. So they were working to include health in the comp plan, adopting a downtown corridor plan, updating streetscape design guidelines, advocating for funding in the capital improvement to implement street improvements to make it more walkable. So they implemented a mix of strategies to basically do some of those environmental assessments to assess current conditions. So some of the things that the coalition did was they did bike ped counts annually, and they also conducted walking audits on the corridor. So those are just some examples. I definitely think that the work that you're doing will really inform the type of baseline data that you want to collect.
Thank you for that, Molly. We do have a question and a comment from one of our participants today. You mentioned government officials and foundations as part of the coalition. If your coalition is formed with the purpose of supporting legislative efforts, these folks can't really be a part of it, can they? So we only have a couple of minutes left. Molly, maybe you could touch on that briefly.
Sure. So I've definitely been in coalitions. LiveWell Wheat-Ridge was a great example where we did have elected officials and staff who were part of the coalition, and when there were specific advocacy steps, they just recused themselves from those discussions. And we talked about it on the front end, and sometimes you can sort of put that into a mobilizing or organizing or advocacy protocol. But I definitely think you can involve those partners. It's just sometimes they have to recuse themselves from some discussions or making some decisions.
Thank you so much for that. Another one of our guests asked if the Spark Policy Institute tool is available for other states to use, if that's available online. Is that a tool that others can utilize?
Yes. Yes. The actual tool itself is not online, but I can send that to you. Findings are online, but I can send you the tool itself. Please contact me.
Okay, thank you very much. We have about 1 minute left, so I'm going to turn it back to Wendy.
Great. Thanks, Alex. And you can move to the next slide. So again, here's our contact information. If you have follow-up questions like the one that was just posed for Molly, here's her email. If you have any questions at all about the Colorado Food Policy Network and what we're up to next, here's my contact information. Also, the first website I listed here is the State Food Systems Advisory Council. We do have an inventory, which we are about to update because it's been about almost a year of local food policy councils. We also have a closed Facebook group for the Colorado Food Systems Coalition. If you're not a member, you should ask me, you can join. And I have sort of my ongoing listserv. I blast a couple emails out a month to folks who are part of the Food Policy Network. So let me know if any of these interest you. Next slide. I have sort of a standing resources slide of some tools and resources we've collected that sort of actually think at the heart of a lot of what Molly has talked about coalition building. And these are ones that other food policy councils have used and sort of vetted across the country. So this will be here for anyone's use. And the last slide, we just want to remind folks that, again, this was the third in our series. As Molly mentioned, Dr. Jill Litt kicked our series off in early April, where she talked about some national and Colorado-based research on sort of what key elements have led to effective policy change-making coalitions. And then Dr. Danielle Varda presented in mid-April specifically about the use of her partner tool that Molly also mentioned that anyone can use to do some self-assessment of your coalition. And then, of course, Molly landed it for us today. All three of these webinars are recorded and available on LiveWell's website that you see here, and we will send a follow-up email out to all participants. So thank you all so much for your time. We look forward to engaging with you all more, and thank you, LiveWell, for hosting this and supporting the Colorado Food Policy Network.
Thank you so much, Wendy, and everyone can keep an eye out for a follow-up email in their inbox with these and other resources on the webinar series. Thank you all so much for joining us, and have a great afternoon. That was sort of a